patient comes in with chest pain, we will page ROMI. That patient is taken by wheelchair back to a room where they're met by 2 nurses, a quick EKG. We start an IV, draw some blood, and they get a chest x-ray. If they're determined that they're a STEMI and they need further interventions, we have 45 minutes to get them up to the cath lab. It's pretty quick. Earlier last spring, we discovered that we had a couple of misses where we didn't make our time hacks. The Partnership Council came up with the idea of using timers. This is a ROMI timer. When somebody comes in with chest pain and a ROMI is paged, a triage nurse or the secretary uses the ROMI timer. They start the timer as soon as the ROMI is paged overhead. That starts the clock, so to speak, in the entire department. The timer is used as a physical reminder to the primary nurse, hey, this patient is on a clock.
Door to dilation time is when a person walks into our ED to the time we get them up in the cath lab and we get that vessel open. Communication is big because it is stressful and the patient is having a lot of pain, and we're all moving very fast. It's a collaborative team effort to get that patient from that ED cart to our table. We make sure that our staff is educated and understand our processes and why we do things the way we do.
We saw our times go from 80 to 90 minutes, and a year or 2 ago to today we're consistently seeing them in the 50 minute and 60 minutes.
Many times the patients start within our region. We brought all of the team members together. We identified some algorithms, built order sets into our Epic, and then shared those. These innovations really assist us in shaving off minutes of time, which ultimately saves patients.
Time is muscle.
Time is muscle.
Time is muscle.